mentioned that, some of what you're seeing is that men are more affected, older men, obese men, men with diabetes. What are you seeing in terms of the trends with women and, dare I say, with pregnant women?
That's a tough question, and that's one that we're still trying to solve and understand. I think, when I think of fertility in general, there's the male factor, there's the female factor, and then there's pregnancy. Yeah. I think what we know about fertility is very limited. There's some small studies that show that you might isolate some COVID RNA in male sperm, but that doesn't mean that this is a sexually transmitted infection. That doesn't mean that it can be transferred. So, like you mentioned, you see the media take on those stories and say, men can transfer COVID through semen, and that's just not true. It has not been proven, and it's something that, as physicians who use social media, we need to be very vocal about the fact that that data is just not there.
And that study startled me when I saw it in the media, because it was while I was trying to recuperate. Mm-hmm. And I said, oh, dear God, I can't believe they're out there saying it's sexually transmitted, because patients freaked out.
Absolutely. I mean, and I understand the patients that freak out, but I think we need to be a little bit more rigorous on the media side as to how we interpret data. But that's why we're here, right?
That's why we're here.
I think, the jury's still out, but I think that for all of those that read those headlines out there, we don't know that COVID can be transferred in semen. We know that it is isolated, but also that study, when you actually read the fine print, there is nothing there that said how the sperm was handled, how it was collected. So, if you cough in your collection cup, you're going to get COVID in the collection cup. And there was nothing there about that. So that makes me reassured for now. And I'm looking forward to seeing more data. On the pregnancy side, again, we have limited data. We have some studies from third trimester women who were in Wuhan, China, who delivered. And there seems not to be any strong evidence of vertical transmission. For the people listening, vertical transmission is a transmission of a virus from the mother to the baby in utero. Some infections of some virus are transmitted and can cause significant fetal harm. Zika, for example, varicella, things that we try to vaccinate against. With COVID, we haven't seen that evidence yet. Again, it's been a couple months. It is limited. But for the people who got infections late in pregnancy, we have not seen that detrimental effect. We got to caveat that and say we don't have enough data to say that definitively, but the fact that there's nothing that is coming up showing that it's definitely there is reassuring to me, at least as of now.
And, if we think of the cousins of SARS-CoV-2, MERS and SARS, we also haven't seen evidence of vertical transmission when those were, at their peak. We also haven't seen evidence of birth defects as we see with Zika, because Zika is sort of the most contemporary example that people pull, right? When they're asking, well, how can you be sure that this virus isn't going to harm my baby? With Zika, you guys were telling everybody to avoid pregnancy, avoid fertility treatments, and here you are saying the opposite. And the reason, of course, that we're not saying the opposite, actually, because nobody said anything definitively, but what we're not saying is that it can cause birth defects, is because we've seen from SARS and MERS and other coronaviruses that that's not the same mechanism that they use. But that said, you make a very good point, which is we just don't know enough. So